And joining us now is Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
So let's talk about those boosters. They've been in the news a lot. It sounds like we may be getting to that point where some people are going to be needing the boosters. Some people out there might be wondering, am I one of these people that needs a booster or not? How would you describe who would need a booster?
Yeah, Marcus, there's two groups. There's the group that clearly needs a booster, which they're not even calling a booster. They're calling it the part of the primary vaccination schedule. These are the immunocompromised patients, people who've had an organ transplant, people who have cancer, other immunocompromised conditions. It's been shown in Israel, France, and Germany that these people do better with a booster. They do better as far as the laboratory tests are concerned, and we think that translates to better health. And this is not unusual. We have this with influenza and with hepatitis B vaccine. You get different kind of doses if you're immunocompromised. That's going to come first. That accounts for 5.9% of the population. So once they roll out, they're watching the next group of people, which is like basically everybody. When is that first bunch of vaccines that you got, when is that going to stop working, protecting you from severe disease? And as soon as that happens, boom, then everybody gets a booster.
Do you think it's kind of a mixed message, though? Because you've got the WHO saying, we want these to go to developing countries, not getting your booster. They need their first one.
Yeah, Sarah, well, this gets into global ethics of a pandemic. How can you be giving boosters when, 70% of the world hasn't even had one shot yet? And so there's an ethical consideration to come in. The Biden administration has said they're going to do both. They're going to crank out vaccine and donate them to the organizations that are distributing these vaccines around the world, and they're going to give American citizens boosters. If you can do both, great. You've got Pfizer, you've got Moderna, you've got Johnson & Johnson. You're very soon going to have the Novavax, so you're going to have 4 approved here. You have AstraZeneca in Europe as well. And then you have, a half a dozen other Chinese and Russian ones that don't work as good, but they're better than nothing. So, all that goes into play here to get everybody vaccinated.
All right, let's go to some of the viewer questions here. First one, some of my coworkers and I carpool. Is it safe for 2 vaccinated people to drive in a car together while wearing masks? What is the chance of getting sick if one of those people has the Delta variant? We'd be working together for hours at a time.
Yeah, if you're vaccinated, you are protected from severe disease, hospitalization, and death. So, that's good. But you can still get infected, but you have typically mild disease. So because Delta is so transmissible, if you're in a tight space, like a car, for a period of time, unfortunately, everyone should be wearing a mask.
Another question for you, Dr. Murphy. Having a backyard gathering tonight for about 30 to 40 guests, asking that all are vaxxed, but some may have attended Lollapalooza last weekend. Should we pull the plug?
Very tough answer here. It depends how much risk you're willing to take. If everybody's vaccinated, again, it's the same thing with the carpool. It's a little easier, though, because you're outside in the backyard. So if you're willing to take the risk, you can have your event. If there's anybody who's at all immunocompromised, if they got any underlying diseases, they should not attend. The safest thing would be to pull the plug. But people are sometimes willing to take that risk, and that's up to you. Be outside. If you can socially distance at all, that would be great. Perhaps even consider wearing masks depending how tight the space is.
All right, Dr. Murphy, thanks so much. If you didn't get your question answered, Dr. Murphy answers them now bi-weekly on Northwestern University's Institute for Global Health's Facebook page. You can also submit questions via email or head to our Morning News Facebook page and post one there. We're going to talk to Dr. Murphy again on Monday. Have a great weekend.
Thanks, doctor.
Great. Have a great weekend.